Hello and welcome back for episode 36 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. I had a nice few weeks off on a holiday in Europe, and I'm glad to be back in Australia now, back to work and getting back on the grind. It's been a few weeks since the last episode, so I must apologize to all the listeners out there who have been patiently waiting for the next episode, but this one is a fantastic one. In this interview, I sat down with Dr. David Attia, who's a general dentist in Sydney, Australia. He is one of the top young dentists that I've had the pleasure of chatting to on this podcast. He does fantastic work in implant dentistry, in soft tissue grafting, and even orthodontics. He is a true CPD junkie, guys, and a real testament to the hard work and dedication it takes to be a top clinician in this day and age. Dr. David Attia has done a Master's of Science in Oral Implantology. He's done a grad diploma in orthodontics and is currently teaching his own course on implants with partners. They've done a modular-based implant course, which keep an eye on his Instagram page for updates. And they're also doing live patient courses, which is a fantastic opportunity for anyone who's interested in implant dentistry to kind of get their hands wet and get that early experience. If you've been enjoying the episodes of the Noobie Dentist Podcast, it would be fantastic if you could head over to iTunes and rate and give a review for the podcast. Also, if you got friends or colleagues or classmates who you think might benefit from the information and knowledge kind of shared on the podcast and think that they may get some great value from it, please kindly pass it along so we can grow the listener base for the podcast. Without further ado, please enjoy the episode.
Hello and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here with David Attia, who's kindly come on again. We actually got together about a week or so ago and recorded a podcast. And unfortunately, from my end of things, the podcast was worst nightmare and had a bit of a glitch and lost the audio file. So thankfully, he's agreed to come back on, and we're going to give this thing another go. And I'm sure it'll be better the second time around. So it'll be more value for you guys listening to the podcast. David, thanks again for coming back on the show. I really appreciate you taking the time during the holiday period.
No, my pleasure, man. My pleasure. It's always good to have a chat.
So like we normally do, if you don't mind, we'll kind of just get into a bit of an origin story, talk about your background a little bit, your journey through dental school, and then we'll kind of pick up from there.
Sure. So my family and I moved to Australia when probably I was 5 years old. I was born in Cairo, Egypt, and we moved here when I was 5 years and 2 months. Lived most of my life in Sydney, and then it was kind of a bit of a shock to the family to be the first person to move out of home for uni. I moved to the Gold Coast and spent my 5 years there. And then I spent some time in Melbourne working, and for the last 3.5 years, I've been working in Townsville, North Queensland.
Awesome. So what was it like when you finished up dental school, finding work? What made you move back to Melbourne? Being from Sydney, like how come you chose to come to Melbourne for work instead of staying in Queensland or going to Sydney?
It was interesting because I think the first day I set foot on the Gold Coast, I said, the day I finish is the day I move back to Sydney.
Yeah.
But in this day and age with dentistry and healthcare in general, actually, it's quite saturated with work, and it can be hard for a new graduate to find work. And I'm talking 5 years ago. Now it's probably even harder.
Yeah.
So when I graduated, I think I flew down to Sydney and I handed well over 200 resumes in practices in Sydney. I think I visited every practice on the Gold Coast, and a few friends that worked in Melbourne, most of which 3 or 4 of which worked in a clinic that was quite nice. It offered all aspects of dentistry. Ortho, surgery, implants, wisdom teeth, general dental, etc., etc. So, I was kind of looking for a job that would set me on the right path to go to where I wanted to be. When you graduate, you think you know everything. You can tackle on every single case way, and it's not as glamorous as it appears to be. So I found a clinic that had offered all disciplines of dentistry, but also had a lot of dentists. This had, I think, 20 dentists.
Wow, it's a big practice.
Yeah, big practice across 2 locations. And it was an opportunity to be able to learn from, 15, 16, 20 different people at any given time. So when I made the move there, I knew some friends as well, which made the move a little bit easier. But that was my kind of thought process. It'll be a couple of years, a sacrifice to kind of learn and get started on the right foot, and hopefully get motivated to do some further education.
Yeah. So it's interesting, when you finish up school, there's so many different sort of career paths you can take, and so many different, courses and things that are available to, new grads. Looking now, obviously you're, 5 or 6 years out, you're doing a lot of, implant work, a lot of surgery, some soft tissue grafting and things like that, which, you're pretty active on Instagram and posting on there. Well, looking back now, are you where you thought you would be like this point in your career? Are you like ahead of where you thought you would be? And like, how has that been like the first 5 or 6 years of your practicing life?
To be honest, when I graduated, I kind of set a goal in my mind to kind of build a foundation in the first 3 or 4 years that you can kind of build on. And it was, I think looking back 5 or 6 years ago, if somebody told me I'd be living in Townsville for 3.5 years, I would have probably laughed and said, no way in the world. But you kind of go where you feel you'll be able to benefit the most and will be able to help people the most. I think where I am now is probably far from where I thought I would be when I graduated uni. I remember one thing Bharat told me when I first graduated. He said, if you can drill straight when you graduate from uni, you've done well. So for me, that was a very, very confronting statement, because you graduate uni as a new graduate, and you know a lot. You know a lot of theory, because that's what the uni teaches you. It teaches you theory, it teaches you what's predictable, but sometimes it doesn't always touch on what you'll see in real life. So to go into clinical practice, a private clinical practice, with that mentality is that I know very little. And every day you'll know more than what you knew yesterday. We hope, anyway. So looking back, I think I've been influenced by a number of people, positively and negatively, because you'll get that in life. It's not just all uphill, and it kind of sets the foundation for you to build on, acquire new skills, know where your deficiencies lie, and then seek out to kind of fill those deficiencies. In your knowledge and in your clinical skill, and you find that over time your hand skills do improve. I remember ashamed to say, but I failed SimLab in second year.
Yeah, I was there with you, man. I remember we had the anterior proximals as like in the second year. And we had the exam, and I'm like prepping it from like lingual, and like I fully like perforated like buccal like enamel. Like my heart sank. I'm like, oh my god, I'm gonna like fail this like for sure. So I called the guy over. He's like, yeah, you're gonna fail this one. Just do your best with like restoring it, and we'll see what we can do. And I was like, all right. So every time I do one now on a patient, like I'm always like thinking back. I'm like, if only this patient knew, like I barely got through this like in dental school, like it'd be pretty funny. So obviously you've invested heavily in educating yourself and upgrading your skills, and learning a lot more in depth than what dental school provided, like in certain, in implants and ortho and things like that. So for the new guys listening, or some of the other dentists who are like me are, a couple years out now and just trying to figure out how we can kind of improve and just kind of move away from just that regular basic general dentistry. Talk to me a little bit about some of the courses you've taken, which ones you find to be most valuable, and how you got kind of implemented these courses into your day-to-day practice now.
Like for me, I had a goal when I graduated to cover a couple of disciplines that I had really, really big interest for. So I guess the advice will be different for every new graduate. It really comes down to what your interest is. I've got some colleagues who graduated, their interest was in peds. I have others whose interest was in endo. So I think find what your interest is when you graduate uni and kind of pursue that. Find a clinic that offers that aspect of dentistry. And if you can immerse yourself in that for long enough, you'll know whether this discipline is what you want to do. When I graduated, there's a reason why they say you can't specialize within the first 2 years of clinical practice. When I first graduated, my first formal CPD was ortho. So I spent 2 years doing orthodontic 12-module program. which was quite intense, very, very practical, and a big eye-opener for all other disciplines. I still do a fair bit of ortho, but over time you find that your interest, what you thought it was in a particular discipline, might change. So, yeah, I think if you spend enough time in a particular discipline, you'll know this is for me, and you'll keep going. Or you'll venture out into other disciplines, and the learning process continues,
So what about sort of, you talked about, for example, ortho, the course of treatment is quite long. So you might start it and you got, some 1 year or 18 months or something like that. That sometimes you got to stick with the patient. And a lot of us are pretty short-sighted and we want like quick treatment, like in and out, get it done. Incorporating implants, you moved on from ortho to some implant courses, and we'll talk about that in a bit more detail, sort of like with the training that you've done and the pros and cons of each one. How is that, being incorporated into your practice daily? Like, when you talk to a patient, especially as an associate working, you're like, I don't know if I'm going to be here in this practice like a year's time from now. So it's tricky to, like, I feel like until you're like rooted somewhere for a while, I can't just start placing implants and then be like, oh, might not be here in 6 months' time to like follow this through, or even worse with ortho. So what kind of advice do you have around that with like treatments? And is it better to be a practice owner first, or be in a long-term associateship before you kind of get into these bigger programs and trainings?
Look, it's an interesting question. I mean, I've thought about it myself a lot. I mean, did I choose the right path? I mean, I'm not a practice owner at the moment. And I've got friends that are practice owners who took the practice ownership path a little bit earlier on in their career. And I don't think there's a really a right or wrong answer. I think I was fortunate enough to be in 2 clinics for a long enough period of time to be able to feel comfortable to do quite comprehensive treatment for those patients, because I'd either been there for a while or my intention was to stay for a while. So when it comes to your question type in terms of implant work, I didn't really feel that I couldn't offer the service, because I was going to up and go in 6 months' time, and I was also in an environment which was very supportive of me doing comprehensive work. The principal did similar treatment to what I did. So in the event that I was going to up and leave for whatever reason or emergency or then there was always somebody to take over the treatment. And it really came down to developing a good relationship with who you work with. A lot of practices will offer many disciplines of dentistry, but restrict their associates from doing it, at least for the 6 to 12 months. They all have that probation period, and the probation period works both ways. It works from an associate's point of view and from an owner. If within 6 months you find that this clinic's not for you, it's not all that it was promised to be, or whatever it is, then you kind of cut your losses and move on early, My practice that I work in Townsville offers almost every type of treatment. We do refer when we need to. And that's an important part of clinical practice. And I think when you do more CPD and more intensive courses, I should say, you realize what cases really shouldn't be touched. And that's what our specialists are for, because specialists are there. They've immersed themselves in that discipline for years and years and years. And some cases really ought to be treated by specialists.
Yeah. Did you, when you graduated dental school, ever think about specializing, or was it always that you want to be a GP and just have skills to kind of do a bit of everything?
Well, when I graduated, we were almost seduced by the notion of these weekend courses. I had friends that done weekend courses in implants, weekend courses in ortho, and I was, I graduated saying, yeah, I'll spend a weekend doing ortho, a weekend doing implants, and that's it. I'm kind of set, Specializing never crossed my mind that early on. I kind of focused on just developing some basic skills and like I mentioned to you, building a foundation that I can kind of improve on. And then when you look back and you see the type of treatments that you can offer and the multidisciplinary approach to dentistry, personally, I think if I were to specialize, it would restrict me a little bit in what I can do. But I know that specialists now can do dual registration as a general practitioner and as a specialist.
Oh, really? Okay.
Yeah. So who knows? Maybe in a few years' time, it might be something that I consider. But for the time being, I'm quite happy doing what I'm doing, sort of thing, and see where it takes me.
So 2 other sort of talking points that I wanted to touch on from our previous discussion. First is mentorship. Talk to me a little bit about the role of mentorship in your early part of your career. How you found it, how you sought it out, and the pros and cons of it. And then we'll move on to the next one.
Sure. So my first clinic, like I mentioned, I had a few friends that worked there, which kind of made mentorship a little bit easier, because you're more comfortable to approach somebody that you have a personal relationship with to ask for help than approaching a associate dentist or a co-worker who you've known all but a week, because you'll find that in your first week you will need help. So I found that mentorship from different number of people was beneficial and also had its shortcomings. People are always happy to help if you're, really, really wanting to learn. But at the same point, later on in life, when I look back, I learned to take everything with a grain of salt. You'll run into more experienced clinicians that have a wealth of knowledge, and you also run into some experienced clinicians who have less knowledge. So when you ask for help, it's important that you seek out, the answer from somebody, but at the same point, verify it. It's important to verify itself, but it's not always possible, because sometimes you'll be in the middle of a surgical and, a root's broken and you're trying to retrieve it, and you don't have the time to go and, research and see whether this approach is correct or not. So I found that in my first 12 months, I learned a lot by seeing. It really solidified in my knowledge and in my clinical ability when I actually did. So 2 methods of learning, I think: doing and seeing. And I think you can't really have one without the other. If you go in there and start doing things yourself first, you'll have a lot of failures. You'll have a lot of complications. You will run into a lot of redos, and you may run into, really difficult situations. If you learn only by seeing, then you don't really get a feel for doing that particular treatment. And it's important to do those treatments not by yourself, but in a controlled environment where you've planned beforehand. You've kind of let a mentor or a senior associate know that, look, I've got this case coming up. I'm prepared to tackle it on. Are you comfortable to jump in if I need you, or to help out? And if you really don't have the backup on site, then you should ask yourself, am I really comfortable doing this treatment? And if something goes wrong, can I get myself out of trouble? And am I doing right by my patient, or should I be referring this case on to a senior associate or a specialist and perhaps going and observing? And it goes back to that kind of the way of learning by observation or assisting,
Yeah, that's great. I mean, that's something that early on, like you said, when you come out of dental school, you kind of feel like, you got it all. You're all that. And you start working in it, a few times you get stuck, but you kind of get by, and you're like, that was a close call. Like, I should have been a bit more prepared for that. And that's something that we talked about last time. I think you were lucky in the sense that when you started working as a new grad, you were in a practice where other dentists were there to, willing to help you or bail you out or mentor you if you had questions. Whereas the reality for a lot of dentists nowadays, especially I think maybe more in North America, where like every dentist owns like 6 practices, and there's like just, new guys kind of just dropped into a practice, and they're like essentially the principal. They're just kind of running the show by themselves. It's hard to grow and like push your boundaries because you don't have that backup there in case you do get stuck and things like that. Yeah. So I think that certainly stunted my growth a little bit. And that initial confidence I had kind of started to, wean away when I was like kind of getting stuck a little bit. And I was like, man, I should really like cool it a bit and just like work my way back up. So that's great. So when you were in these practices, you had the confidence that someone's there to bail you out. Tell me a little bit from, obviously we talked about last time how planning comes into it. And the more you plan for a case, the more you're prepared for, possible things that can go wrong, the more confident you are during the procedure. Tell me a little bit about the confidence that we didn't talk about this last time. I don't think the confidence of, presenting big cases, presenting bigger treatment plans to patients. And I think, based on the frequency of stuff that you're posting on sort of Instagram, like the amount of cases you're doing, I mean, it's one to have like the skill set for sure. Like obviously if I can do implants, if I can do ortho, I can offer it to the patient confidently. But I still think case acceptance and, case presentation is a big part of dentistry because you're trying to advocate for the patient, offer them the best possible treatment. And sometimes, that's a bigger price tag associated with that. So as a new grad, sometimes you struggle to like talk about these bigger cases because in your mind, you're like, okay, well, 1 crown, that's like $1,500 is a lot of money for me. Like, I'm not going to present 8 crowns to the patient because it like seems like ridiculous, but you have to get there. So tell me a little bit about that journey for you in terms of the case presentation side of things.
Look, I really got into more comprehensive, these types of bigger cases when I moved on to my second practice. And I think it really came down to the way the practice was built. If your practice is built on treatment planning comprehensively, then it'll be a lot easier to communicate to patients these bigger types of treatments. Certainly, if you have the skill to do the treatment, it makes things a lot easier. And I mean, I ran into some interesting situations when I first graduated with these bigger cases. I mean, I was confident enough to be able to speak to the patient. I had done the education to back up and allow me to do the treatment. But being a slightly younger clinician in a clinic where I've been an associate for 6 months in my second practice, we would treatment plan big cases, but the patient would say, yeah, that's fine, but I want the principal to do it. Yeah. So you kind of, it's kind of like a kick in the guts a little bit, but you kind of think back and say, well, if I was in the patient's shoes, would I be confident to have somebody, remove all my teeth and place 4 implants? That was, 4 or 5 years out of uni? Probably not. It's not to say that, if we're 4 or 5 years out, we can't do that type of treatment. Not at all. I think it really comes down to the patient expectations. I learned that the hard way. I've kind of reached the point now where I'm very, very blunt with patients when it comes to possible complications, their expectations versus what I believe I can deliver. And if you really have that honest conversation with the patient, I think they gain your trust. You gain their trust in that you can fulfill their expectations or meet their concerns or whatever it may be. When you know more about something, you speak more confidently. At the same point, I've met some clinicians who know a lot of theory really, really well. And it's interesting when you meet people from different unis, you can see the difference in knowledge theoretically as well as clinically. I've got friends that can recite journal articles off the top of their head. I can't do that. But when it comes to implementing, the hands really need to back up the theoretical. So you can get some clinicians that can sell ice to an Eskimo, but when it comes to clinical application, it might not be the same story, which is fine. I mean, it's great to be able to be a good communicator, and I think that's what really comes down to. Can you communicate effectively to the patient? And if you can get them over the line and you're not comfortable for the treatment, then you've done your practice as a really, really good service. You've, helped a patient. You've referred a case onto a more senior dentist or principal, and you've gone and assisted or observed and learned. That's free CPD, man. You can't get that anywhere.
That's such a great tip. I think a lot of people can become short-sighted and I'm like, oh, I lost my production for that, blah, blah, blah. But to see it the way you saw it is very positive, like growth mindset kind of way. Like I'm going to learn from this case that I diagnosed and treatment planned, and I can watch somebody else do it for once or twice or 3 times. Then I can see how they do it and pick it up and kind of, incorporate that myself going forward.
Yeah.
So have you done any sort of training in communication or anything like that? Or is that something that you've just been more comfortable with naturally and just have, shifted your focus more to the clinical side of things?
I mean, when I compare my first practice to my second practice, they're worlds apart. The first practice was, we were seeing patients, short appointments. Sometimes I was seeing 12 to 14 patients in 6 or 7 hours. And it was kind of patients in, patients out, waiting rooms full of patients, 6 surgeries pumping, 2 hygienists. Like it was, it was really, really overwhelming. And you kind of feel like, okay, as a new graduate, I've got all these patients waiting. I need to finish treatment really, really quickly. When I changed practice, it was a bit different. It was all about taking a step back, slowing down, comprehensive treatment planning, spending more time with each patient, getting more quality work done, and spending a longer time with a patient means that you kind of build that rapport indirectly as well, even though you're in the mouth the whole time doing treatment. If a patient's willing to spend 2 or 3 hours with you, then they've really entrusted you with their care. So I would always sit in on the new patient consults with my boss. For my first 12 months, I was in there. Every single new patient exam I blocked off in my book, and I was there just watching how he communicated with patients, how he provided metaphors or analogies to patients to kind of get a point across, But 6 months in, I felt that even though I'm learning from him, I need to do something myself. And I find that when you go and spend money on a course yourself, you really want to implement it because you've just dropped $2,000 or $3,000 on a course, and I've spent the money, so I really need to put this into practice. So I went ahead and did Prime. I think it was in February of 2016. Yeah, 6 months or 8 months after moving up to Townsville. And it really put things into perspective for me, even though I was kind of living through it at work, hearing it every single day, even from the nurses. The whole practice was built around that philosophy. When you do the course yourself, it's a little bit different. But I've also chatted to friends and who have different approaches. I mean, Prime teaches that every patient can be treated in a similar approach. But I think when you factor in patient psychology and all those sort of things and the demographics of a particular area, Prime's great. I loved it. But in the real world, there's lots of different people that you'll run into. So having discussed with friends, you pick up tips as well on small tips here or there, small phrases that just stick with you and say, oh my God, that makes sense. If I say that to a patient, there's no gray area. It's just,
I love that. Those tidbits are really good. I personally, I listen to obviously a lot of different podcasts, like dental ones. And that's where I learn a lot of it. Like a lot of it, you pick up little phrases or tidbits and you're like, wow, I can drop that every patient and it'll just work every time. So for me, that's something that early on I've been pretty interested in, because I figured even if it's just fillings and crowns and simple work, the more you can do of that, obviously, the more your books will be full, and you can kind of grow as a clinician that way. So I think that's been a really positive investment so far, like my early part of my career. And I think I encourage a lot of people to, especially if they're not naturally a little bit more confident with speaking and presenting to patients, that they should really invest. And I'll put a link to Prime, because I think that in Australia, Prime seems to be a pretty popular program and course for a lot of dentists and practices. All right, so let's let's go to your wheelhouse a little bit here, your bread and butter, sort of like implants and soft tissue stuff. I know that's something that you're passionate about, and you're teaching and you're running courses and modules and hands-on components as well. Talk to me, if you can, about your implant journey, sort of like from where you started, and like we talked about last time, you started taking some, you did a live patient course. And then realized you need some structured programs. So tell me a little bit about your implant journey so far in your career, and where you hope to take it going forward.
Yeah, I mean, for me, the interest has always been there in surgery and specifically implants. I remember attending the Young Dentist Conference when I was in final year. That was in Sydney, August 2013. And I ran to a guy who I'd met once before at one of the dental conventions, student dental conventions. And when I ran into him at the new graduate course, we kind of got chatting, and he just started his formal education in implant work. And I remember actually opening up my phone and just writing the name of the course, and said, this is going to be on bookmark. I'm going to hit it up, once I'm out. And then, when I decided to make the move to Townsville, I kind of spoke to my boss at the time, and he recommended a live surgical program. And that's when I made the decision to do that. And part of the confidence in doing that only at the beginning was that I was going back to a practice that did a lot of implants. And I was with an ethical boss who treatment planned cases, who looked at cases from every angle. So I kind of knew that mentorship would be enough to kind of get me by once I've completed this so-called life surgery course. And for the first 40 or 50 implants, I had Matt come in, and he held my hand basically. Placing 20 implants on patients in a week just isn't enough. It's a start. It gets your confidence up. It allows you to kind of feel and experience what it feels like to place implants. But there's just so many voids in your knowledge, and having a mentor there looking over your shoulder and checking your angulation and checking your flap and your closure every step of the way was just invaluable. You then get to a point where you kind of it becomes monkey see, monkey do, and that's not implant dentistry. That's not dentistry at all, actually. So I think I got to the point where after 12 months of placing implants, or 16 months of placing implants, I've placed, I think, around 40 to 50 implants. I realized there's too many voids. I need to be able to think for myself. Having a mentor there, as we discussed last time, it gives you a bit of a psychological support, but it can be to the point that you don't think for yourself. You've got that psychological dependence on somebody being in the room next door, that if I do something wrong, they will bail me out. And it's not the case unless you're an employee and you're operating under vicarious liability. It's, you know, everything that you do is kind of on you. So you need to really think about your cases. And I got to the point where I was like, okay, I'm treatment planning my cases, but if all goes wrong, I'll just have somebody come in to kind of bail me out. So that's when I kind of started researching into programs that would allow me to be more independent in my thinking, in my treatment planning, and also in my implementation. You know, my boss isn't going to always be there. You know, he takes trips, he takes CPD courses. I might be in the clinic on my own, and the patient's booked in for an implant. Can I confidently place the implant or provide the service to my patient on my own with no assistance? You know. So mentorship was great, but it kind of, having said that, when I found that I was developing that psychological dependence on somebody else, that's when I realized, like, I need to do something more. And I kind of went and just, you know, said, let's do it. Put my made the decision to do a more structured course in a tertiary institution, and it's been great. It's been a great experience for me. In kind of allowing me to do more treatments, and you know, we get into debates now, we get into discussions at work about, you know, which treatment approach is best, and that in itself has been a really, really big motivator and inspiration for me to go ahead and read more and learn more, and try alternate techniques that did make sense to me when it was explained to me, and yeah, implementing, trying, and getting feedback, documenting your cases, because when you document your cases, the first thing you look at isn't the good. The first thing you look at is where you went wrong.
Exactly. I've been doing that too. I think it's a really, positive way to grow. Like I said, documenting photography and just being honest with yourself in your critique of your own work. So when choosing a more structured implant course after you did the live one, you mentioned, there's like tertiary ones like through a university program. There's also a lot of, modular based, like private sort of CPD programs and things like that. And I think you mentioned one, I think it's called Guide or something last time. Yeah. So talk to me a little bit about the two options there, because I know a lot of people who are listening who may be considering, do I go back to school and do something a bit more formal to get like a formal degree with it, or I can just take a little bit more in-depth CPD sort of approach to it and do a sort of a modular program. Talk to me. I know you've obviously thought about this a lot in choosing between the two paths. But also you come across a lot of people who've done both or either one. Talk to me a little bit about pros and cons of those ones.
Look, I think there's really no wrong answer as to what you do. I think if I could have it anyway, I would do every course. Every course you'll pick something up. I've spent some time with Sasha, who does run the Guide program. He did a sinus lift course with Chris Ho last year. And I was fortunate enough to attend that, and I picked up a lot of tips, a lot of little gems that I had never thought about or I'd never been taught. I think doing any structured program that is not just a simple come in, we teach you how to place implants in 2 days, you work on a model, and then you can go out and place implants. I think anything beyond that, you find that if it's a modular program and it's well structured, you have a look at the curriculum, have a look at what will be covered, have a look at the speakers. There's a lot of courses out there now. There's a lot of speakers out there now, and it's important for you to kind of really, really research these programs. I've had a few friends that have done the Guide program and love it. My friend from Perth, who I mentioned earlier, his clinical practice is 75 to 80% implant work now. He's a general practitioner. And Guide set him on that path to be able to confidently treatment plan cases, to be mentored by specialists, to be able to place, implants and do comprehensive treatment. I guess the program that I did in Germany was a little bit different. It was a university program, and we're fortunate enough to have those types of programs here in Australia. The grad dip at Sydney Uni and Charles Sturt, as well as JCU. It's when you're learning in a university setting, it's a little bit different. It's formal. It's formal education. It's just like your undergrad. There's examinations. There's things that need to be ticked off and signed off, and you're accountable for everything that you do, for everything that you write. So it really instills, as a bare minimum, discipline. So when you go into cases after you've done a very, very structured program, you are now disciplined to treatment plan the case from start to finish, have a look at what could possibly go wrong, communicate all that effectively to a patient, execute the treatment, and manage any complications that go with it. Because you've kind of, when you have to do a master thesis, that's 6 months. Right? That's 6 months of no sleep, 6 months of writing, 6 months of editing. It's hard work, and I think if you can get through that, you put the same effort into your cases. I mean, some people do those programs for the wrong reason. It's about getting the letters, or it's about just saying that I've got a master's degree or a postgrad diploma in ortho or in implants or whatever it may be. So you really got to ask yourself, why are you doing the program? What are you looking to get out of the program? And is there something that would be more suitable to meet your expectations from said program? Yeah.
Okay. So there's one big question I have, and I think it'll be a lot of good value from it. So, knowing what you know now and sort of the courses and everything you've gone through, say one of the listeners right now, like say, for example, myself, like, we're working in practices where, we're busy, we're doing some good work. But, like you're interested in implants, for example, and implants, like, unlike endo or unlike, indirect restorations, there's a big sort of like barrier to entry in terms of material costs and things that you need in the practice kind of set up. And so is it worthwhile? Like, how would you sequence it? Would you find the job first that is an environment where they will be nurturing you and have already, placing implants and things like that, and then you can kind of do the training to catch up to the rest of the clinicians in that practice and kind of get going? Or is it worthwhile to, speak to your, current job and be like, I want to do implants as an investment for myself and maybe the practice? And do you think they'll kind of accommodate you that way? If someone's in a practice that's not doing implants, but they want to do implants, basically, what would you be advice to them?
First of all, speak to your principal or speak to your practice owner or whoever may be in charge. Implant inventory is a big outlay. Implant marketing is a big investment. So if you're in a practice that's not really driven that way because the principal might not be doing implants or whatever it may be, or they don't want to, absorb the liability that comes with implants from somebody who's never placed implants, then you really think about that discussion first prior to either one, paying for the inventory yourself, or two, going ahead and investing in a program. Certainly, I don't think that should be a hindrance from doing the education. I think you will gain knowledge. You will never fall back. You will never be at a loss by doing either a structured program or a modular program in implants if your practice doesn't do implants. It's more so what everyone looks at is the ROI. Can I implement? On a lower scale, I did a composite resin course in June last year, and I went back to practice and I didn't implement. It didn't implement what I learned for 6 months, and I forgot everything. The little tips and tricks that were in my mind that I remembered when I left the course were no longer there. So it just became kind of like I'm winging now. I'm just winging it. And I had a refresher 3 weeks ago with Barat and Johan, and I said, I'm not going to make the same mistake again.
I've seen you implementing it a lot, actually. A lot of the posterior compasses and stuff, so it's good.
So I said, I'm going to go back to practice, and the first patient that needs a resin, I will implement what I've learned. So if you go ahead and invest on a larger scale in an implant course, we might be talking $15,000, $20,000, and you don't implement, then you may forget what you've learned. You may be discouraged to place implants 6 months from now because you feel that you don't have the confidence or that sort of thing. Another approach would be to find a mentor, not necessarily in your practice, and go and observe, whether it be a specialist, whether it be a colleague, whether it be a friend. Go and observe, and perhaps, if you've got patients that require treatment in your practice, a lot of the good implant companies now will provide you with inventory for your first few cases. They'll bring the surgical kit, they'll bring the surgical motor, they'll bring the implants that you need, the healing abutments, etc. and provide that service. I mean, I work closely with a couple of companies, and I found that service when it comes to implant work is key.
Yeah.
You know, it's, if you can have that and have a mentor there with you, then, you know, you can slowly get into the process of providing that service, and maybe your principal dentist may be more open to the idea of investing or helping you set up a bit of an implant service in that clinic.
Yeah. So I think the big fork is the big fork in the road is, do you take CPD that fits your current practice and allows you to maximize your current role, or do you seek a role that gets you where you want to get to, like, long term? I think that's a big decision a lot of people have to make, including myself, I think, because you know, if you know, you're like, in 5 years time, I want to be doing implants, I want to be doing this and this and this, and your current position doesn't really facilitate that, then you got to decide, okay, maybe or if I got to change all my courses to like Warren Dentition and like PROS related things. So you got to kind of decide that, I think, pretty early on in your career. And that's it can, you know, change how your career trajectory kind of goes. So it's a big and interesting choice to make. The point about the structured learning, I think, is great. And like we talked about, I think, you know, there's 3 or 4 of you guys in Australia that I've met now, and have all done the program or in the process of doing the program, and are just doing, like, you know, great work. So I think it looks like it's a positive step to take if that's where you are in your career and you're sort of ready to take on that responsibility. One thing I'd like to talk about a little bit, if you don't mind, is just your mindset doing these programs, because obviously a lot of it is on your own time after work, and you got to make sure you're, like, responsible, like you said, and you build the good habits by doing it. Where does that motivation come from? Is it like professional satisfaction, or is it the potential of, like, the ROI side of things? Talk to me a little bit about that, like, growth mindset that you've had since you've graduated, that, you know, like, no, I want better, I want more, I want to be better at my job. Talk to me a little bit about that, because I think a lot of people, you know, we get into that comfortable space, and we're like, we go to work and we just do what we got to do, and it's like stress free, and we come home and we're, like, relaxed. Whereas some people want to continuously, like, push themselves and challenge themselves at work, even though it might come with, like, more stress or more liability and things like that. So tell me a little bit about your mindset, because I'm interested to see sort of what pushed you through all this period.
I mean, when you think about the way you practice it, everybody's different, and I think what for me was I guess the what triggered or the catalyst for me to get into something like that was I realized how little I know. The deficiencies in my knowledge, even though I was doing more extensive treatment, was becoming more and more visible every day. You know, I would be doing cases and I would realize that, okay, this doesn't look too right. I was getting advice from people, and I realized, well, I could have avoided these situations had I had the proper training and education. The other thing is, if you think about, you know, I want to provide what's best for my patient, it really does confront you. It's kind of like, well, you know, if I've just gone ahead and spent a weekend and did a course on implants, and I'm ready to place my first implant, is that really enough knowledge? And the other thing was influence from colleagues. You know, when you associate yourself with a group of people who are pushing you day in, day out, one, you don't want to fall behind, and 2, you're motivated to do more and more because you want to be at a level where you can fit in with that group. You know, and I don't think it should be the only driving factor, but I think for me personally, it's, you know, I was fortunate enough to associate with 4 or 5 people that really did influence me early on in my career. They really challenged me. They said it like it is. You know, if I did something that wasn't 100% correct, I knew about it, and it wasn't coming from a position of arrogance or jealousy or you know, that sort of thing. It was coming from a position of, I want you to do better, so I'm telling you like it is.
Yeah.
And the feeling's mutual, you know. I'm getting a few people who are very, very close to me who ask me questions, and I'll say, look, if I can be blunt, because really I do want you to do better, and privately just guide them in rectifying a case or way to avoid this in the future. So having those 3 or 4 things influence me, you know, realizing how little I know, having people that kind of really pushed me beyond my boundaries. I said, well, you know, it's important to kind of get the right education. For me, it was a structured program. It doesn't need to be a university-based program, as long as it's a program that is all-encompassing of a particular discipline, encourages you to do other courses. You know, I'm running some courses next year, but it's not the be all and end all. I encourage every person who attends one of our courses to go and do more courses, because you'll never learn everything from one person. I've been influenced by a lot of great people in Europe, a lot of great people in Australia, a lot of great people in the States. Instagram now has become a very, very big learning platform. You form networks and you know, alliances with people, and they're more than happy to help you. A lot of these guys are specialists, you know.
Yeah, it's amazing.
When you've got humble specialists who are willing to help younger people who really have a desire to learn, like, you know, the Chris Ho's, the Tony Rotondos, the Stephen Chens, all these guys who are happy to teach younger people, because ultimately it really comes down to the patient, doesn't it? Yeah.
I think that's great. You dropped a few like gems in there. I think that one motivating factor of just providing the best possible care for the patient, I think that's huge. And it's like pretty overlooked. I don't think many people in their mindset, like they might be like, okay, one is like professional satisfaction, two is like money or whatever. But I think that putting that patient, you know, putting the best patient care possible as the forefront of like your motivation to be better, that's huge. I think that's like the right mindset for it. And two was you know, like it's like a common phrase of like, you're the average of like the 5 people you hang out with the most. And like, that was like, I think that's a huge point that you made. Like if you're amongst people who motivate you and are pushing you, if you're not just like hanging out with like the same old crowd that are just complacent and just like your high school friends or whatever, it's important because like it pushes you, it drives you to be better and do better work and try and catch up to them and stay in the conversation so you don't get left behind essentially. So I think that's a fantastic point. And I think that's something that everyone should try and do. And I think Instagram is good for that, because even if you're in your surrounding town or your environment, you don't have people that are like that, you can always like have people on Instagram that are posting more regularly, and you try and interact with them and try and keep up with them in that way.
I think personal satisfaction is also something that I did overlook, and you mentioned it. And I think, you know, patients can see that. You know, when you spend the time to do a layered posterior resin that the patient will never see, you're placing the rubber dam and the patient's kind of looking up at you like, what are you doing? Just get this done. It was funny because I had a patient a few weeks ago, and, you know, I had a new nurse that was training with me, and I said, look, you know, these fillings can be done in 10 minutes. You know, the patient was in the chair and he was like, what? We're 40 minutes into the appointment and we haven't finished yet. I said, but it's all about restoring nature for the patient. The patient's not going to see this restoration. He might not appreciate the anatomy that you've put in, or, you know, the biomimetic caries that Johan always puts in, or already. You know, when you take pride in that restoration, you're not providing the patient with a filling. You're providing them with a restoration. You're restoring what they had. And, you know, I took the rubber dam off the patient at the end, and he looked up and I showed him the photos, and he said, now I understand why you took 45 minutes to do 2 fillings instead of 10 minutes. Mm-hmm. So I walked away kind of, I was satisfied with what I did, but I was also more happy that the patient understood where we're coming from, and we're actually doing it for the best interest of the patient. We leave and go home, and we're very happy with the service that we've provided because we've done what's best by our patient. And the patient leaves knowing that they've committed their care to somebody who's looking at, you know, who's dotting their I's and crossing their T's, as they say. The patient, you know, it comes down.
That's huge. I think if you look at it from the patient's perspective, you know, they've been going to dentists their whole life, and they're in and out, and there's like either amalgam, just like a massive amalgam with like a Toffelmeyer band or something, and they come into like, you know, one of our practices where, you know, we're, you know, trying to do good work. So we got a rubber dam, we're taking photos, we're like micro etching, and like, you're like, what are you doing? Like, I've never experienced this. So I think the patient education is a little bit of a factor. You'd be like, this is why we're doing what we're doing, and it's for your benefit. And we're trying to just do something that's going to last longer and function better and cause less issues in the long term. But I think you also get to enjoy it. Like if you're taking pictures of your work, it means you're not trying to hide anything. For one, like the patient, I think, can pick up on that. So I think, there's nothing bad that comes from it. It just maybe takes a little bit more time. So maybe like you're less productive, but I think at least you're happier.
Definitely. Allocate more time. When you start documenting your work. I mean, I was probably documenting only my ortho work early on. And then I think after 18 months, I started to document everything. And, you know, one of my big inspirations on Instagram is a friend of Johan and Bharat in the UK. And, you know, when it comes to photography and dentistry, says dentistry is passion fueled by photography. You know, he takes photos of every case. He sees what could have been better, and it motivates you. And when when you see where you've come, when you look at photos that you've done 18 months ago of cases and you've done the same case now, the difference is phenomenal. You know, if you're putting your mind to it and you're putting in the effort, you'll find that you do improve. You do improve. Your hand skills get better. When you see more, you can do more.
Yeah, for sure. I think, photography is a big game changer. Just being able to blow things up and look at them a bit larger, and you see like all your deficient areas and things like that. Definitely makes an environment for growth. So before we kind of wrap things up, I want to talk about your course a little bit, because I know it's coming up. So you got a live patient component of it. You got some modules coming up as well. Talk to me a little bit about your course and what you're hoping to provide over the next few years for participants.
Yeah. So next year we've got a couple of live surgical training courses coming up. We've got a basic course that's running in Cambodia, and a more advanced course for people who do have experience with implants in Malaysia. And I guess the course aims to the basic course, I should say, aims to provide participants with an experience in placing implants under the mentorship of clinicians who are from Australia, who practice everyday dentistry in Australia by Australian standards. And I think it's important to kind of highlight that point, because there's a lot of courses out there that you'll go and you'll place 20, 30 implants in a week's time, and the standard of care in another country might not be the same that what it is here. So having experience with a live surgery course, it was good to kind of look at what I would love to provide and what I experienced. But we've also acknowledged the fact that live surgical course, as we touched on prior, is not the be all and end all. The biological foundation and the theoretical knowledge is just as important. So we've put together a few modules starting probably the second half of next year, a 5-modular program that covers everything in implants, from start to finish in terms of documentation, treatment planning, setting your practice up for implants, how to market implants, how to train your staff in implants.
That's huge. Yeah.
Prosthetics, simple single unit bridges, complex socket grafting, GBR, as well as the soft tissue side of things, which I'm quite passionate about, as well as just the knowledge on some full arch solutions as well. Not necessarily suitable for every clinician to go ahead and do, but it's important to know. It's important to know what's available out there, so you can at least educate your patients prior to referring them on if you're not comfortable to do the more extensive cases. And the theoretical component will include hands-on on models, hands-on on animal heads, hands-on photography, to get people into the good habits of documenting their work, treatment planning, and that sort of thing. And I do have a passion for teaching. I do have a passion for sharing knowledge. Just like people helped me when I was younger in my career, I kind of look forward to helping people not make the mistakes I did, because I made mistakes when I first started. And it's important to acknowledge those mistakes and not hide from them, and learn from them and help others avoid them.
That's awesome. So in terms of the sequence, would you recommend maybe doing the modular component first before doing the live patient, like hands-on component, or what do you think would be more valuable for participants?
It's a good question. I think, look, personally, I don't think you could go wrong either way. But if I was to have to recommend one, I would say probably get the theoretical side of things done first. And the way we're actually structuring it is we're spacing the modules out. A lot of courses that I've had friends attend or I've attended have had the modules really close together. So, you're learning basic stuff, and then bam, you're into a lot of advanced techniques, and you haven't even had time to implement the basic stuff. So, the 3 later modules will be more comprehensive or more complex type treatments like GBR and soft tissue grafting and full arch solutions. So we want to space them out a little bit. So the first 2 are relatively close together, and the last 3 modules will be, a few months down the track. In that break for the modular program, we're looking at providing a live surgery stream as well. So,
nice.
So that way, as a group, they're together for the theoretical, and they can also, if they wish, halfway through, go and do the live surgical component in Cambodia or wherever it may be, so they can implement what they've learned in module 1 and 2. The flip side is if they've done the live surgery already, and they're enrolled in the modular program, then they can do module 1 and 2. They've already got the practical experience, but now they have a biological foundation and a kind of a treatment planning philosophy that will help them to put what they've learned from the practical into practice in private practice with a solid biological foundation and scientific backing. So yeah, you can't go wrong either way. If I was to do it, I'd probably do the theoretical first.
Sounds like it makes more sense that way. You have the backing, and then you kind of get your hands wet afterwards. Yeah. That's great. So I'll for sure post all the information if you can send me the links and everything in the show notes for anyone interested in attending. I think it's great, and I think the fact that you're teaching it, and obviously you have partners and things like that as well. And one is obviously you're a general dentist. You're still like fairly early in your career, so you can relate to some of the new grads and like the stuff they're going to be dealing with and the kind of the pitfalls and things like that. So I think you're more relatable, which means like the learning experience will be much more relevant. If you have like some 30 year practicing like periodontist or oral surgeon, they might not relate with like your small issues of like raising a flap or something or like that, because like for them it's like they don't think about those kind of things anymore maybe necessarily. So I think it's a lot of good value. I think it's going to be a great program and a great course. And I wish you success in that as well, like going forward. I think it's going to be something that
I'm always happy for people to kind of email questions and text me questions. Sure. I mean, on a weekly basis, I'm getting final year students or first year graduates asking questions about extractions or which courses to do, etc. So I'm always happy to kind of help in that regard. If it means getting you on the right path to selecting the correct CPD or maybe off for the minute and kind of mastering some basic stuff first, and always happy to kind of help and guide in that regard as well.
That's great. And I think that's huge for our Instagram too. I'll put your show notes in the show notes, your Instagram account as well. It's growing pretty rapidly. I think obviously you're putting a lot of work towards it, and it's paying dividends. So building the brand, which is awesome, and what we're all kind of doing as a bit of a side hustle too. So, all right. So what we like to do is just kind of wrap things up on a bit of a rapid fire here. I'll get into it. So what is your favorite pizza topping?
You asked me last time, and then I went, what the hell? I did mushrooms last time, but I really do like chili. Yeah.
If you weren't a dentist, what profession would you be in?
I would be playing professional football.
Being a footballer? Yeah, I think you talked about being a footballer last time. So what position did you play when you're in it? I
was an attacking centre mid. I did like to get a bit more forward, but I really love that attacking centre mid position.
Yeah, do you have some good pace, or?
I had good endurance, good fitness, and box to box type stuff. I was relatively quick, but when it came to 12, I kind of gave all that up, unfortunately.
That's awesome. Yeah, I was a big soccer player as well. I mean, I was a goalkeeper.
Really?
Similar to you. Yeah, so similar to you, I was, like during high school and stuff, I was playing pretty competitively in university as well. And then, like you said, the immigrant parents kind of persuade you towards academics a little bit more, so it kind of shifts your priorities a little bit.
Yeah.
But I still look back with, I'm like, oh, what if if I pursued a bit more? Yeah, when I got to Australia, though, I started playing futsal. Futsal is pretty big here and like in Southeast Asia and stuff too. So I started playing pretty competitively in Melbourne, like in the V League and things like that, which is pretty cool.
Nice.
So what procedure, if you could do only one procedure in dentistry, what would it be?
Surgery.
Just surgery? Yeah. What's one procedure that kind of makes you question your career choice in dentistry?
Contrary to my last post on Instagram, probably molar root canal.
Yeah. And what's your like go-to footwear for work? Are you like a sneakers kind of guy, dress shoes kind of guy?
I wear scrubs to work, so I do wear sneakers.
I
find it's a lot more comfortable. It breathes a lot better, and if you're comfortable, you're going to be able to do better.
Do more work. Were you ever like a suit and tie kind of guy at work? You've always been more scrubs.
Slacks and a polo. I've never been a suit and tie, but it actually took me a long time to get over that boundary of wearing scrubs. I never really bought it until I actually got into scrubs, and I was like, now I can see what the hype's about.
It's pretty comfortable. I used to be like, in my first year, I was like full scrubs, like scrub top and bottom with sneakers, and then I was like, that's a bit much. So now I just wear like dress pants and scrub top. Dressed it up a little bit, but it's been great. David, man, thanks a lot for coming back on. It's pretty embarrassing on my part to lose the first one, but I think the second one's probably a little bit better anyways. We've gone through it once. a lot of great value, a lot of great talking points with implants and surgery. There's certainly not a lot of general dentists, certainly this early in their career, that are doing like the amount of work that you're doing. So I think it's pretty inspirational, and it's cool to kind of talk to you and see what your journey was like. So if people have questions, I'll guide them towards your Instagram page. And if you can send me your course details as well, that'd be great. We'll post them up for anyone interested in implant dentistry.
Awesome. Thanks for the chat, man. Thank you.
Yeah, it was great. Thanks.